Gomes' current medications. Okay. She'll be on aspirin, 81 milligrams once daily.
Are those the baby aspirins?
Yeah.
Okay.
Okay, I have that.
It's a baby aspirin enteric-coated. So its name is Equitrin. Equitrin.
So it's a prescription aspirin because no.
You can get it over the counter.
Okay.
Equitrin.
Uh,
I might have it.
He's gonna give us a list.
Atenolol,
Oh, okay.
which is a beta blocker,
Mhm.
and she used to be on this before, and then it's 50 milligrams once daily. It's a beta blocker. What it does is it helps to calm the heart down.
Okay.
The other
Does that matter if it's morning or night?
At least it's once a day.
So it doesn't matter when during the day. Okay.
Next medication is atorvastatin, brand name Lipitor, 80 milligrams once every evening.
Okay.
And what that is it prevents cholesterol buildup. So it's 80 milligrams.
And it might even dissolve the cholesterol you were saying, the buildup,
Yes.
right?
And it's something that we may later on cut the dose down, but right now that's the maximum dose.
Okay.
The other medicine is called Irbesartan or Avapro.
Mm-hmm.
Okay. The prescription that she has at home is 300 milligrams, and we're going to give her half the dose, so that's 150 milligrams once a day. Okay.
Morning or night?
Yeah.
Okay.
Just once a day. Now the other medicine is called Brilinta or Tagolor. It's 90 milligrams, one tablet twice a day, morning and night.
That's the blood thinner.
Yeah, that's like the super important, not to miss a single day.
Okay.
The other medicine is the Lexapro or ESCITALOPRAM oxalate. Okay, that medicine is for depression, and it's 10 milligrams. That was prescribed by her PCP, and one tablet daily.
Okay. That was Janie Chen's.
Yeah.
But you're gonna reconfirm with her.
Yeah.
Okay.
And I'm also gonna ask her about the trazodone. For some reason that was on her list from discharge from the hospital.
Okay.
And then she was also listed on her discharge medication was melatonin, 3 milligrams to help sleep,
Right.
Oh, okay.
So
That
I
might have
just
been
wanna-
what they gave you.
Yeah.
That's like a maximum dose of melatonin.
Yeah.
Okay.
And the reason the Tenolol, usually after even a small heart attack, beta blockers calm the heart down after an event. That's why they said to continue it, but they didn't realize that she hadn't been taking that. Yeah.
Okay.
So
All right.
that kind of updates us, reconciles her current medications.
Okay.
So I cannot emphasize enough, the Brilinta, 90 milligrams, one tablet twice a day, is for 1 year.
Okay. It's an imperative.
Yeah. Aspirin is for
Life.
lifetime. And any time she goes for any procedure, surgical procedure, you gotta let me know if you have to stop it, because typically what happens
for the
is
blood thinning.
typically if you go for any kind of surgical procedures, what's going to happen is that they're going to want to stop it, like
Sure.
5 days or even like before procedure kind of thing.
Right.
But we like her not to have to stop that at all.
Okay.
I mean,
So you need to coordinate with the doctor, and he has to coordinate with the surgeon or
Right,
whatever.
yeah.
yeah, and just in case, some
Yeah.
you need some kind of a surgical procedure or something.
Sure.
So we'd have
Okay.
to discuss, that.
Yeah.
And then you'll want to see her next week, Monday.
Yeah, I'd like to see her back
Monday.
next week, and I'm gonna order a blood test. It's a blood test for cholesterol,
Okay.
and also a CBC just to make sure the platelet count's okay.
Okay.
and there's
So
no,
Is
no
there a
way-
lab here in the
Yeah,
building?
there is.
Okay,
Yeah, if there's one lab on the 5th floor.
okay, great.
Could I have it done that same Monday, or you want it done ahead?
It might be a good idea to do it ahead,
Okay,
because
So-
it takes at least 24 hours to get the results.
So
Okay.
maybe you go in on
Okay.
Friday and take the test?
Yeah.
Would that be good?
That'll be good.
Okay,
okay,
so I'm talking to the phone now. Gwinnett,
Yeah.
she has to go Friday for a blood
Yeah.
test.
So just to recap again, regarding what the plan forward is, the plan is that she'll be wearing this life vest for 3 months. We're gonna be evaluating her throughout the 3 months, but at the 3 months level, we're gonna determine whether or not she will need to have a implantable cardioverter defibrillator, and that's based upon if she has any events
Right,
such as passing out. And we would also want to assess how her heart function improves. So along in the next 3 months, we will probably in a month, I'll do an ultrasound of her heart
Mhm.
to see how well the heart's squeezing.
good,
My hope is that with more blood getting to the heart muscle, that the function in the bottom and the tip of the heart will improve, and then we won't need to have to put in a implantable device.
Good. All right, and one last thing, you don't want her to drive for 6 months at least.
Yes.
Okay.
Yeah, I would recommend no driving for 6 months because of her passing out spell, and she's wearing a life vest.
Right,
Yeah. So I think it'll be the safest. You know,
right,
No,
okay,
I don't expect anything to happen. However, it would be safest for her. You know,
right.
not to
that's
have
fine.
that.
All right,
The other thing is also be very cautious if any blood draws. So make sure to hold pressure a little bit,
So-
5 minutes.
we have to do that
Mhm.
on Friday.
Okay.
So
Yeah.
Gwinnett,
Okay.
remind me and I will talk to you
Okay.
about that, what she has to do.
And the main thing is because oftentimes the lab technician, they just, they're not sure that you're on a blood thinner, so they'll just go like
Right.
this,
Right,
and then what happens is that you get a big bruise, So
Right.
if you just take your time and hold pressure there
Mhm.
for 5 minutes, man, should
No problem.
even though you're on this blood thinner, blood does clot. It just takes a little bit longer.
Right.
That's the mechanism behind it. But
Okay.
the purpose of the Brilinta is to prevent the stent from clotting off. That's why it's so crucial.
So you don't get
and
blood
take-
clots.
Yeah, it takes a good 3 to 6 months normally for a little layer of tissue to grow over the stent so that the metal is not exposed to the blood any longer. As long as the metal is exposed to the blood, there's some risk of clotting. So that's the reason for the blood
Okay.
being on the Brilinta. But the studies have shown that patients who have like a small heart attack or any heart attack, that they should be on a combination of aspirin plus Brilinta for 1 year. So aspirin indefinitely, Brilinta for 1 year. And,
Okay.
and that's the reason for it.
Just tell us what to do. All right,
okay.
anything else, doctor?
Yeah, and then I did give you, I did give you samples of Brilinta, 90 milligrams twice a day, a total of each bottle has 8 tablets, and I gave you 7 bottles.
Okay.
Okay.
Would you be so kind as to call in all these
Yeah.
prescriptions
Yeah.
to
Well,
the,
she has enough of the
okay,
let's
let's tell you what, we'll check, and
Yeah.
if we need something, we'll
no,
call you
I'm
up.
gonna give her the prescription for the Atenolol.
Okay,
Okay,
That's the only one she needs. I'm gonna give her samples of Brilinta. You're gonna get generic aspirin,
yeah,
Ecotrin.
I
Yeah.
have that.
Yeah, and then
can you call it into the Polylongs?
Yep.
Okay,
we can do that for you.
Okay.
great.
And if there's any questions, you can reach me in my office at 587-8322, or you can call me through my answering service at 524-2575. I'm available 24 hours a day, 7 days a week.
Okay.
Okay?
All right, thank you, doctor.
You're welcome.
That was very good.
Okay.